as they did before, and probably huddling up a little more and congregating. And it's kind of like, summer's here and business is reopening and everything is okay, but in fact, that is not the case. On the research front, we still don't have an effective treatment for this thing. Obviously, everybody and their brother who can is working on a vaccine. There are at least 135 different vaccines in some stage of development now, and at least 16 are in some phase of human testing. You will have read about one that Dr. Fauci, has said might be available by early 2021. That is a vaccine that is targeting what's called the S or spike protein on the virus. The good news is that it appears that antibodies that develop to the spike protein are protective. However, no one has yet developed a vaccine that works in humans targeting that in the manner that this is being developed. So the one that's really, well, several on the fast track, but this particular one, if it turns out not to be effective clinically, that could be bad in that, there's a lot of hopes pinned on it. There are other vaccines using there are multiple different biological techniques that you can use to develop a vaccine. The ones that are furthest along are using newer technology, so to speak, and not many vaccines using these technologies are in use. So my word, I guess my comment on that would just be stay tuned. We have high hopes, but we don't have anything that's been proven to work yet. The states around us seem to be bubbling and surging. South Carolina, North Carolina, Tennessee, Alabama, Florida, they all seem to be surging, and I'm not sure that there's anything magic about the Savannah River or the Chattahoochee River or the St. Mary's River or the Blue Ridge Mountains. And so as people from other areas come in to visit us and come into our area, they certainly can bring the virus with them. I just remind you that we are still in the midst of a pandemic, and without that treatment and without the development of an effective vaccine, absolutely the only things that we know that work are those things we've been talking about now for, since February, March. Social distancing, wearing a face mask, washing your hands, covering your coughs and sneezes. It gets a little boring to keep saying the same thing, but those are really the only tools we have that we know of that are effective. And I don't think there's any question among the scientific community now that wearing a face mask actually does help prevent the spread. But I would encourage you to remember that when you wear your face mask out in public or to a meeting, it doesn't protect you from catching the virus. It protects the other people. It prevents you from giving it to them. So you're wearing it to be socially responsible and protect your fellow man. I guess for the time being, that would be all I have as far as an opening update, but I'm happy to entertain questions, and if I missed something obvious, please let me know.
Thank you so much, Dr. Davis. I guess I'll start with the first question, which would be this, is that we are open now at a worse time than we were when we closed initially. I think if you go back 110, 11 days when we were starting to look at shutting things down, and we did, our numbers were nothing like they are now. And now we have restaurants that are closing because they've had infections and a variety of other things. Understanding, again, the very precarious position you're in, what advice do you have for us as an elected body that ultimately is charged with public safety and welfare, as you are, to try to stem what's going on?
Well, we know more about the virus now than we did then, and I think early on, literally it was the first name of this thing was novel coronavirus 2019, you know, so nobody knew anything about it before December or January. We know that the way it spreads primarily is from person to person, either with aerosol droplets or sharing utensils, you know, kissing, sharing saliva, so to speak. So we know that's the way it's spread. It theoretically can be spread by surface contact, and I would encourage you to continue to clean, but it seems it's much more likely to be spread by prolonged, close personal contact. You are correct in that our numbers are higher now than they were to begin with, and that the economy is reopened. And with that, I think the general public, now being 2.5 or 3 months tired of trying to be socially responsible and practicing social distancing, is ready to get on with their lives. So I would encourage you, to the extent that you can, to continue to model good behavior. You know, wear your face mask, wash your hands, use hand sanitizer, etc. B, continue to put that message out there that this does not appear that heat and humidity have thus far diminished the contagiousness of the virus. Encourage businesses to police, so to speak, their own establishments, and if they see patrons that are not behaving in a socially responsible manner, to encourage them to do so. And I think those are the main things that, from a legal standpoint, you can do. Anything that encourages the use of face masks and encourages the lack of indoor congregation is a good thing. Moving activities outdoors is better than having activities indoors. I hope that answered your question.
It does. Thank you. Any questions from members of the council for Dr. Davis? I see Alderwoman Bryan. I see Alderman Leggett.
Good morning, Dr. Davis.
Hello.
How are you? How are you? I guess you're our Dr. Fossey here in Savannah. Thank you so much for your service. Just want to ask you one question. I was on your website, but I wanted you to talk to us and explain to us what community spread means, because we had asked about how to determine and connect where the person was last when they received or they became positive. Is there something, or can you explain to us how we narrow areas? Because they said that was on your site, but I didn't get a chance to look at that. Just wanted to see if you could address community spread.
Well, one of the challenges facing all of us is reopening schools in the fall. The communities need the schools to be in to provide, not only education for the future generation of our people, but also to provide daycare so mom and dad can work. And we tried to come up with a metric or a measurement that would give us sort of a relative indication of how active community spread of the virus or community transmission might be. And if you look on, if the mayor looks on the spreadsheet that I share with him every morning, down under the big line of numbers, there is a number that's calculated, and it's calculated for each county. I'm doing it about three times a week for the benefit of the school superintendents. And it looks at the total number of cases that have been reported in the previous 14 days, and we divide that by the population of the county, and that gives a rate per 100, and then you multiply by 100,000. So it gives you a rate per 100,000 people of cases that occurred within the past 2 weeks. And that's a reasonable number to sort of gauge how robustly the virus is spreading in your community. The higher it goes, the worse it is. And even though our numbers here in Chatham County, have been increasing as they have in Glenn County and pretty much in the rest of the district, compared to some other parts of the state, we still actually look pretty good. So we have more community spread now than we had earlier, but comparatively to the rest of the state, we actually still look pretty good. And I'm not sure that exactly answered your question.
Well, let me just rephrase this. I'm just trying to say, I think you mentioned it earlier, that blacks in our community are not taking the test as often as other races in our community. And so with that being said, do you have a way of showing by zip codes how it's affecting our community? We had asked about it once. I know some other states are doing that, and I guess right now we're not. I'm just interested in, after you making that statement, where in our community, those zip codes where there is an increase in the virus.
Yes, ma'am. I'm with you now. I do have 1 week old data on zip codes in Chatham County. I have previously been asked, and I've shared with the mayor, I've been asked not to release those. However, it is being freely released in the metro Atlanta area, and as of the next time I get an updated set, which will either be tomorrow or Wednesday, we will certainly publicize that. It's pretty much, I can tell you, it's all over Chatham County. It's not confined to one place. But I would go back to what I said earlier. We really need to take a closer look, and I just simply don't have the data yet to see how many people we are, the breakdown of the people who are actually testing. I have a feeling that, as I said earlier, that we are oversampling the white population and undersampling, our black population. And if that turns out to, in fact, be true, we need to figure out a way to improve that PDQ.
Okay, so why I was asking that is because if you can narrow it down by zip codes, we as city council members could possibly, kind of beat the pots, beat the drums. This is happening in our districts, and that's why I was asking about, how it's affecting the zip codes in our area and where they're located in the districts of Savannah, because a lot of people aren't taking this serious. As we as city aldermen, it's incumbent that we put out these fires and let people know in this district there are X amount, and you can get tested, because I know they're all over Savannah giving tests. The other question that I want to ask is there another method other than the nose swab? Because I've heard that that's very painful. Are we doing any other types of testing other than the use of the swab?
Well, that's still the gold standard. What everybody is trying to work on is what's called serum antibody testing. Mm-hmm. And there are a host of serum antibody tests out there. The problem with most of them is that they're not necessarily very accurate. Mm-hmm. They will improve, and there's no reason that they can't be made very accurate. We have a very accurate antibody rapid screening test for HIV that works on the same principle.
Okay.
And so they are coming. There are at least 4 coronaviruses that circulate in humans pretty much all the time. Many of the initial serum antibody tests that were put out there could potentially cross-react with those other coronaviruses. And so if it said you have antibodies to coronavirus, you don't know if it was SARS-CoV-2 or one of the other ones. And they could even be, falsely positive.
And you've been listening into an emergency special called meeting regarding COVID-19 here in the city of Savannah.
Mayor Van Johnson calling that meeting. Of course, right now you have Dr. Lawton Davis, Director of the Coastal Health District, answering questions, taking all the information and sharing it with the members of the City Council. And of course, we will have a complete recap coming up on our early news on WJCL 22 News at 5 o'clock. Right now, though, we do want to